and can make it available to you if you need it. And we'll also put it on our YouTube channel. Connie, I'll now turn it over to you.
Thank you. Today we are really excited to launch our new health equity data dashboard. So we also want to share a preview of our 2023 health equity report coming out later this year, as Kathy mentioned. So health is not just about whether someone has diabetes or heart disease. Health is about our daily life experiences, the environments where we live, work, learn, and play, and the opportunities to live a successful and healthy life. So what is health equity? Health equity is a fair and just opportunity for everyone to achieve their fullest health potential, including groups who have been historically marginalized by race, religion, ethnicity, disability or ability, sexual orientation, gender identity, social economic status, national origin, and other factors. So achieving health equity is core to our mission at Louisville Metro Public Health and Wellness, and it's woven throughout our decisions and daily operations. Achieving health equity requires removing obstacles to health, such as poverty, discrimination, and their consequences, including lack of access to a good job with fair pay, quality education, safe and healthy housing, safe environments, healthy food, and quality healthcare. All of which aligns with Mayor Greenberg's goal of Louisville becoming a healthier city. As a city and a society, we must understand the factors so we can overcome these obstacles to a greater health. Data is a valuable tool to help us. So this new data dashboard is a great tool for our community. It puts data in the hands of our community and decision makers and explains the ties between health outcomes, their root causes, and the systems of power. So now I want to introduce Angela Graham, our executive administrator, who has led her team in developing the health equity data dashboard. And she'll go over key points about the dashboard and provide a demonstration. So Angela.
Thank you, Connie. Good afternoon. I'm going to share my screen and walk through the dashboard a little bit and just show you some of the features and functionalities. So this is now live, so you have a link to this and you can go and explore this for yourself. But just for today, I want to show you just a couple of things that might be helpful or useful to know. So this is our landing page. We've got a little bit of background here, but I really want to show this link at the bottom. There is a contact form, and we would love to hear from anyone that uses the dashboard about how it's working for you. If you have suggestions for data sources or topics that you'd like to see us feature, we'll be happy to try to integrate those as we go through and make future updates. So we are releasing the first set of pages today. There are 7 out of 16 health outcomes. We also are sharing a couple of pages that have some narrative and some demographic background. And we intend to continue working to release more health outcomes and more pages of data that we think will be useful for the community. So up here, you can navigate to all of the different pages. This page, Invitation to Imagine, you'll see this line up really well with the preview and the additional health equity report as it comes out. There's just a little bit of narrative content if you're interested in understanding a little bit more of our vision and the vision that we worked to build with the community. Some key concepts and definitions, and these are all, of course, drop-down interactive features. And at the bottom here, we've included the vision statements that our community advisory board and over 150 people and organizations worked with us to create. So these are our visions for health equity that we've created with the community. Some of these pages have just a number of maps and dashboards that you can interact with. We've disaggregated the data as much as we can, depending on the data source itself. And it's as up to date as we have available. So we encourage you to explore this and take a look at what we have. And I'm going to show one of the health outcomes here and just kind of walk through some of the features that you'll see. So of course, across the top, you've got some buttons that'll jump you down into the sections. But if you are interested in homicide, for instance, you can come to this page, read a little bit of background about what the health outcome itself is, read a little bit about the key findings and data trends, and we try to put Louisville in context with national data where we can. We have some maps and graphs here as well, and these are very interactive. So if you want to see the actual values behind this, if you're working on a report, a grant writing, or anything else like that, you can come in and see that. Legends are available, of course, for everything here. And many of the health outcomes we've broken down in this way. So you can see race by gender, race and ethnicity, gender by itself, and then a trend, a year-over-year trend. And again, these are interactive. And if you want to zoom into one, say you want to do a screen grab for a grant or a story that you're writing, you can easily do that with one of the graphs. And then further down, we've got a discussion of the narrative, the root causes behind whatever health outcome you're taking a look at. So in this case, with homicide, we've taken a closer look specifically at poverty and concentrated poverty specifically. And there's some discussion about the research behind it and some context for how that plays out in Louisville. And we go on to discuss systems of power, so how things like racism and classism maybe impact the patterns that we're seeing in our community. And again, we try to bring in as many examples or discussions of things that have happened in Louisville as we can to make this as local as possible. And then, of course, if you really want to get deep, there's a very long list of references for every page. So that is our dashboard. We have really tried to work intentionally to make this as interactive and user-friendly as possible. We heard from community partners in the past as we've released data that they really want something that's interactive. They want to be able to get in the data themselves. So this will be our opportunity to do that. We intend to update it at least once a year. The data is tied to things like Kentucky Department of Public Health data, death records, birth records, and then in some cases, CDC or Census, American Community Survey data, and many other sources. So as those data sources are updated, we will be sure to get our pages updated as well. And I think with that, I'm going to hand it off to Dr. Single to talk about the rest of the report.
Thank you, Angela. So first of all, I want to thank all the media outlets for being here. Our work is not worth much if our public is not aware of all the work being done. So thank you for joining us. This is truly a proud moment. I want to thank Angela, her team, all the CHE team, all the people at Louisville Metro Health, Public Health and Wellness, the advisory board, and the rest of the Metro government for coming up and working tirelessly to come up with this project. COVID did push us back, but here we are today. So I just want to speak about health, as Connie alluded to it. You know, when we speak of health, having good health is not just about having good genetic makeup, or making good choices. It is also about choices people have. People make choices what they have. Choices are sometimes dictated by the policies and the practices that somehow allocate resources more towards one community and create scarcity for another community. So when we talk about health and healthcare, or we're not just talking about, you know, as Connie alluded to, diabetes or high blood pressure, it's about the environment where we live, about scarcity of healthcare access, food, good environment, and safe housing. Our income, where we live, our zip code, race, sex, that all dictates the health outcome, profoundly dictates our health outcome. In 2011, we published our first health equity report, and it was received with great enthusiasm, and it really brought to surface health inequities, why just within few miles and few zip codes, there could be a huge difference in life expectancy. It brought to the surface and underscored the need to look at health inequities in a more, I would say, in a conscientious and intentional way, and work towards finding solutions. So the 2011, 2014, 2017 reports really highlighted and brought community partners to work together about different root causes and what can we do to alleviate these inequities. 2023 report that we releasing now in 2024 is we calling it an invitation to imagine. That's the title of this report. And I'm going to take you to an allegory by Dr. Kamara Jones called Gardener's Tale. And I think that summarizes why we're calling this an invitation to imagine. She mentions that how a gardener has the power to change how the plants thrive and survive and thrive. A gardener controls the soil, controls the nutrients, controls the environment, which allows certain polar plants to thrive and certain plants do not. So she sort of equates the circumstances, the environment in our society to that garden. And she further states that how the government policies, the community partners, all of us and media is the gardener in this environment that creates those situations where certain communities thrive and others do not do well. So as Angela brought to your attention that there is power over or power with solutions and systems of power with and power over. There are some transformational changes and there are some translational changes. Most of the times, when we think of a problem in the society, we react to it in a translational way where we try to just find solutions to that one problem, which is almost like putting a band-aid. But we are saying we need to start thinking in a transformational way where we look at a problem, we look at underlying root causes, which we have been doing and we have made some progress, but it's time to make intentional efforts to make a systemic change so we can give everyone an opportunity to thrive. And we'll further say that the rest of as Angela mentioned, rest of the 9 health outcome will be on the data dashboard in the coming months. And we'll also release the whole report very soon. I'm going to make one last comment. And as Dr. Kamara Jones said, I think we all have to act as benevolent gardeners. And that means all of us. That means our government policies. That means all our community partners. That means all of us have to look at this from the lens. What can we do so that we can create an environment, create a place where every Louisvillian have equal opportunity to thrive and have a very healthy life. Thank you. Connie?
Thank you. So thank you, Angela and Dr. Singal. So next steps. So our next steps will be using the data and the report and the dashboard and community input to conduct a community needs assessment for Metro Louisville. And then depending on what the community determines are the priorities and the community focus, a community health improvement plan will be developed to guide and direct our strategic plan, Healthy Louisville 2030, and prioritize public health projects for the coming years. So we expect that, well, some of that progress has already begun. We'll continue with that next month, and we will share widely an invitation for all to participate within this community needs assessment.
Good, thank you, Connie. I don't yet see any questions in the chat. If any of you have a question or if you would like Angela to bring that dashboard back up for you to ask any particular questions, or if you just want to have time to look through it on your own, that's fine. If anybody has a question, you can go ahead and unmute and ask the question. Okay, Connor put in the chat, what can you say about the role COVID-19 played in the decline in life expectancy? What other factors have influenced that decline? Connie or Dr. Single, or both
Sure.
of you, would you like to weigh in?
Yeah, I can begin, and Dr. Single. So COVID-19 certainly decreased our life expectancy, and more and proportionally more for people of color and for those other populations that we discussed. So of our population, those that were already experiencing lower life expectation, fewer years of life, that was seen more, due to COVID. The other thing that we've seen as far as decreasing life expectancy would be opioid use disorder, overdose, given the epidemic that's going on right now with opioids. So those are two of the factors that we've seen. And I'll pass it on to Dr. Single and Angela to share more.
Yeah, so Connie, I 100% agree with what Connie said. And once again, what's to highlight, even though across this country, our life expectancy has dropped some for all populations, but it has definitely affected people, as we have pointed out, certain population more than others who were already at disadvantage due to lack of access to good healthcare, good food, good livelihood, good environment, safe housing. And we have seen the same thing in Louisville, on West End or Northwest End, the life expectancy has decreased a little bit more than it overall nationally. As Connie pointed out, even though the overall deaths of opioid use disorder have decreased slightly, but for 2022, we noticed that the number has actually jumped quite a few percentage points for Northwest part of the town. So we have to, again, it's just repeating myself, we have to make a conscientious effort to use this data, analyze this data, use this data, and bring all the community partners together to find solutions so we do not continue on this trajectory.
Good. I don't know if this might be, I'm totally throwing this out. Angela, would it be worth pulling up the life expectancy data on the dashboard and also elaborating some of the root causes and some of the transformational actions that we might see?
Yeah, I'm happy to pull up life expectancy because you can, in fact, explore some of the trends in our dashboard. So overall, you can see trends here year over year. So we use a 5-year average for life expectancy, but you can see there's a little bit of a decline in Louisville, similar to what we're seeing nationally. As Dr. Single alluded, it is lower for non-Hispanic Black populations specifically, and for males in general, and that's similar to the trends that we see nationally as well. And you can kind of take a look at it too geographically. So you can take a look at how trends have occurred geographically. So our Northwest neighborhoods, as Dr. Single mentioned, you can see starting to see a marked decline in life expectancy there. Other geographies, maybe not so much. So when we consider the concentration of poverty in Louisville, concentration of resources versus relative abundance, we know that this area of town tends to have that concentration of scarcity versus other areas of town in the east parts that have been the beneficiaries of legacy of policies and decisions that concentrate advantage and resources for them. So those are some of the underlying factors that attribute the change in or just decrease it or relative stability of life expectancy.
Thank you. Before we close, Angela, do you want to mention a couple of the other health outcomes that we will be adding to the dashboard over the coming months?
Yeah, so we have released the first 7. Some of them are our biggest contributors to decline in life expectancy, our biggest causes of death in Louisville. So it'd be cancer and heart disease. We included a few that are relatively maybe smaller contributors of mortality and morbidity, but we think maybe of interest to people. In the coming months, we're going to continue to release up to 17 health outcomes. So that'll include diabetes, substance use disorder, mental health, and suicide, stroke, intimate partner violence, and a number of others. So if there is something you're really interested in digging into and it's not on the dashboard, it may be coming. And if you really make sure that we release it first, please reach out to us via that link and we'll prioritize.
Great, thank you. Okay, I don't see any other questions in the chat. So thank you to our speakers. Thank you, news media who are here today. If there's something you think of after this, or if you'd like a copy of the recording, you can just reach out to me, Kathy Turner, and I'm happy to follow up with you. But thanks for attending today. That ends our press briefing.
Thank you.